All right, so I tucked my shirt in for you guys to look nice and snazzy. No, it's actually so you can see how my core works. So we're starting to get into engagement exercises. I like to call them kind of engaging resets. When we go through the whole process that we've been through so far, which is the rolling, the self-myofascial release, the breath before that, and then after the self-myofascial release, the active stretching, we've begun to unravel our tightness. We've begun to relax our muscles, but we have to re-engage them. We have to reset them. We have to make everything work again more functionally. And there's a very specific process to that. And the process thus far is also very specific as well. So you have to go through this entire process the way that it's laid out for you. You could do all the exercise first, but if you haven't reset and released all the muscle beforehand, it's just things are not going to activate the way they need to. But hopefully you've gone through the course the way you should have, and you're a little bit looser, you're a little bit happier, and now we're going to start to sweat a little bit. So we're going to start off, you don't need any tools for any of this. You're just going to be on the ground for the most part the entire time. So we're going to lay on the ground on our backs. Okay? And this first piece is the breath that we begun with, the very first session, the very first week, the breath that you practice is going to be incorporated. But now we're going to be a little bit more intense with it in our exhale. So you'll notice I'm here in a bridge position. My feet are close to my butt. You can do the hands too to start if you like. Okay, I'm going to breathe into my nose, but now I'm going to breathe out of my mouth, and I'm going to purse my lips to kind of blow intensely. And what this does is it activates the transverse abdominis more, and also the diaphragm, to create a little bit more engagement in the lower core, okay, the lower abdomen. So it's going to look like this. You can see how low my lower abdomen has dropped because I'm engaging that TVA. Then I'll inhale again. So I'm very consciously pulling my belly button in and down as I exhale. Psoas engages as I inhale. TVA engages as I exhale. And that inflation and deflation is very important. Okay? So it's very simply using the breath, but just exhaling more intensely and pulling that belly button down. Okay? So when you're doing this, and for the rest of these exercises, I encourage you to actually time yourself for how long you're doing it, so you don't have to focus on reps. If you're here counting like 1, 3, 5, 7, and you're kind of getting misled with focusing on that, then you're not focusing on the breath. So if you have a little timer here at your phone or whatever, your watch, have it go off at about a minute, 2 minutes if you want to work longer, okay? But use the timer, okay? So that's the first piece, okay? Now the next piece, you're going to continue lying, and we're going to do what's called a posterior pelvic tilt. Really not complicated, especially laying here on your back, but we're going to incorporate the breath. Okay, we're going to inhale first. Belly rises as I inhale. Now as I exhale, I'm pursing my lips just like we did. My belly button is going to drop, but this time my pubic bone is going to pull towards my sternum. So inhale first. Exhale. Belly button drops. Pull pubic bone towards the sternum. So I'm doing this kind of crunching motion, but my legs are not being used. Although my hips look like they lifted, I'm using core, okay? Specifically TVA, rectus abdominis, okay? You'll notice that my hands became closer together. And then I relax. Do it again, inhale. Exhale, belly button drops. Belly button pulls down, pubic bone towards the sternum, squeeze. Still exhaling. And relax. Now you can really make yourself sweat with that, okay? You can really squeeze hard. I do this is like my go-to core exercise because I can just lay there. I don't need to do much of a warm-up, and it's gonna really activate everything the way I need it to, especially before a workout, okay? But obviously we're aiming for low back pain, so it's great because it gives you kind of a natural spinal traction to relieve all of the pain you could be experiencing in your back. Now, This pelvic tilt is going to be practiced, okay, in several different positions. I'm actually going to say 5 different positions, maybe 6 actually. So the next one, you're going to practice it on your side, and you can do each side. Obviously, I recommend doing each side. So I'm going to lay on my side here, probably do something with the mic. So I had you practicing breathing on your side before. Now we're just going to do that same pelvic tilt that you were doing just now, but now on your side. So I'm going to breathe in. You can't really do too much with both hands here because you're kind of stuck with this arm above. But I'm going to inhale deeply like we practiced the first week. Now as I exhale, belly button pulls in, squeeze the core, kind of sliding the knees in, but not using your legs, not using your shoulders. And then relax. Inhale, belly button fills, exhale, squeeze, pulling the sternum towards the pubic bone, shortening this space. For all of these exercises, the slower you go, the better, okay? Now, if you're here doing, like breathing really fast and crunching and stuff, crunches are great for building the core, but they're not safe for the back, and it's not really gonna truly help strong, slow muscle tissue activation over the course of many months. This stuff is gonna last for a long time. Okay, so obviously you do that on this side, you would do that on the other side. The next position, this looks nice and weird for you, but I promise it's extremely helpful. The next position is going to be on your stomach. Okay. Now, it looks like I'm just humping the ground here, okay? So I promise it's not for that purpose. It's for the betterment of your low back health. But you're going to place your forehead on the back of your hands in some way or another. You'll notice I take my big breath into my stomach, my back will rise, similar to what we practiced before. Now, as I exhale through my mouth, I'm going to think about pulling my belly button up off the ground to round my lumbar spine just a little bit. So my pubic bone is pulling towards my sternum. You can see some action happening as my hips look like they're lifting on the ground, off the ground. I'm not using my hips, I'm not using my legs, I'm just using my core to pull this up and off the ground. And then I relax. So again, I'm going to inhale, you'll notice the breath. Exhale, squeeze, pull that belly button up. Relax. What you're probably noticing by now is that after every rep, you're completely relaxing. That is important. I want you to take a second in between, totally relax, disengage, and then reinitiate the movement again. Okay. So the next movement, or position that we're doing this movement in, the posterior pelvic tilt, is going to be in a tabletop position. So cat-cow is a full spinal extension and spinal flexion. Okay, but what we're trying to do is just control our lumbar spine by doing the pelvic tilt. So you'll notice the differences in this motion that I'm offering you is that you're doing a cat-cow, but just within the lumbar spine, okay? So I'm gonna breathe in, and you'll notice in this position, as I breathe in, my belly fills with air, like we've been talking about. As I exhale, I'm pulling the belly button up, and I'm doing a pelvic tilt, but just in my lumbar spine. So my tailbone is curling under. Nothing else in my back up here has changed. Just the belly button pulling up, tailbone moving forward. And then I'll inhale, go back. Not hyperextension, just neutral. After that inhale is complete and I'm at neutral, I go back. Exhale. Do not do this, okay? And that's going to be pretty coordinatively challenging for many of you. So just practice kind of doing a little motion. If you got to focus on that rather than the breath at the same time, that's fine. Just practice that. And then when you feel comfortable, begin to initiate the breath again. Inhale, exhale. It's a very small abbreviated breath. Not breath, movement. It's a very small movement. Okay, that's the fifth position after you count both sides, laying on your back, the stomach, now the tabletop. The last one is the standing position. Now this is going to be something that we talk about going forward as far as the mechanical habits that we're going to introduce to you as you exit the course. But this next one, as we're standing, I'm going to show you from the side, I'll show you forward as well. So I like to place my hips on my side just so I can feel what's happening here. I'm going to bend my knees slightly, okay? Very gently bent. My feet are pointed forward, shoulder width apart, hands at the hips. Keep your eyes forward for this. We want to tend to look down and see what's happening. But I'm going to look forward, and the main reason why I have my shirt tucked in here so you can see something like this is I'm going to inhale, stick my tailbone out behind me. You didn't see much happen there. My back doesn't arch too much, but it's just a little arching of the back. Now as I exhale, you'll notice I pull my pubic bone towards my sternum again, but now I'm standing. Belly button draws in. So this is that posterior pelvic tilt, engagement of the TVA and rectus abdominis again, just standing. And then I come to neutral with an inhale. Belly inflates. My knees haven't bent. The height of my body hasn't changed. So I'm not dropping, I'm not moving, I'm not leaning. This tends to be a really common issue. As I initiate someone sticking their butt out behind them like this, we'll want to lean forward, okay, stick our butt back. There's no shifting of anything other than just this subtle arching of the lumbar spine and then flexion of the lumbar spine by squeezing all of this, okay? So those are the pelvic tilt positions. As I mentioned before, you're doing something like 1 minute to 2 minutes for each of those positions. If you have one that you enjoy more than the other, or if the standing one is too difficult for you, then don't do the standing one and do more of one that is actually beneficial for you and it's a little bit easier for you to coordinate. Okay? So now we're going to move along to a little bit more of like a psoas engagement with all of this stuff that we've already begun. The TVA is what we've been working on and pulling and doing this spinal flexion. A little bit more psoas engagement now, which we talked about in the first couple videos as far as how the breath works with it, and then also when we were releasing it. All of this is in this anterior core musculature. Now we need to teach it to work just like we just did with the TVA. Okay, so we're going to lay back down. So we're going to do that pelvic tilt like we did. Okay, we're going to inhale into the stomach. And then I'm going to posterior pelvic tilt like we did before. Once I complete this flexion, I'm going to then bring a knee into my chest. As far as I can go, okay? As far as I could consciously pull this knee into my chest, okay? Without using my hands or anything like that, and with that breath timed perfectly, okay? So I'm gonna go through it again. You'll notice that I also incorporate the breath going back out, but I hadn't gotten there yet. So we'll start it again. Inhale, exhale, posterior pelvic tilt, squeezing, still exhaling. Now I pull this knee in. You'll notice my foot is dorsiflexing as I do that. Still exhaling, right towards my right shoulder, right chest area. Now I'm going to inhale out, all the way down very slowly. Stomach is rising. Relax. So I'm going to go through the whole motion without saying anything, believe it or not. Inhale. Exhale. Oh shit, I said something. Inhale. Okay, so I did that entire thing without speaking, big surprise. Now we're gonna incorporate 2 legs at a time, okay? Now the breath is very important for these, so you must do the breathing technique with the movement, okay? That's how we're activating the cell, that's how we're activating the TVA properly. Okay, so there's much importance on remembering that. So I'm gonna inhale, we're gonna do the same thing but with 2 legs. Curling. Inhale back out. Relax. And repeat. Exhale. Posterior pelvic tilt. Once you finish that, pull the knees in. Inhale out. Nice and slow. Okay? All right, so that's that exercise. We'll call that a posterior pelvic tilt with a leg lift or knee tuck, whatever you want to call it. And then we're going to move along to something a little bit more difficult. We're going to move along into what's called an inverted chair position. So you can continue laying on your back, and you're going to bring your knees and your hips up to a 90-degree angle. Okay? The angle is fairly important, but obviously we're all a little different in our strength and capacity. So what I'll notice with some people is that they'll need to pull the knees in a little bit more than I may be able to control. So, aim for 90 degrees in the knees and hips, but, the more important thing than that is actually just keeping your low back flush to the ground. So when I'm working with clients and they're in this position, I'm always putting my fingers in this position to make sure there's no space here, okay? If the back arches like this, you're losing stability and you're hyperextending that low back, which is not safe, okay? So to push the low back down, you're pulling the pubic bone towards the sternum, kind of like we were just practicing, but now the knees and hips are up, okay? So from here, you can just hold, pulling the toes back, keeping the knees and hips where they are, pushing the hands down through the ground. Now watch my breath. This is also one of my favorite core exercises. It's very simple. You're fighting really hard to keep that low back flush to the ground. If you feel a trembling sensation, you know you're doing it right. The muscle's activating there. If you feel pain in your back as you're doing this, stop. Okay? If you need to pull the knees in a little bit more to make sure that the low back is flush to the ground, then go ahead and do so. Okay. Now there's another progression on top of that. Now as we begin to incorporate a little bit more challenging exercises, remember that some are not appropriate for you. That's okay. Okay? There's more challenging things that some people can handle and some cannot. So if we go along this process and you're like, oh, I can't keep this control here, it's a much better bet to just stay at the place that's appropriate for you and not move along. And that's totally okay because you will eventually get to that strength. It's just appropriate to time it when you're not experiencing as much pain or you notice yourself getting stronger. Now, the next progression of this inverted chair is going to be a little hip extension. So I'm going to extend my leg or lower my foot towards the ground. There's a couple different ways we could do this. But now again, the breath is important for this movement. Okay? So this time, I'm going to inhale as I lower my heel towards the ground. My low back is still flush. This is extremely important the entire time. My low back is flush. I inhale as my heel drops towards the ground. Exhale as I pull it up. Alternate. And I find that 90 and 90 each time. I'm not going down with one and pulling this one in. It's a static position as far as one leg goes while the other is sliding down with the inhale. Exhale. Same position, inhale. Okay? Now again, like all these exercises, you're appropriately timing them as well. So I said a minute for each of them before. This is the hardest one thus far, and some people can't do a minute. If you can't do a minute of the movement, do a minute of the holding. If you can't do a minute of the holding, do 30 seconds, 15 seconds, 20 seconds, whatever it is, keeping that low back tight to the ground. Most important part. All right, so we got some more. We're gonna get into kind of like the tabletop bear crawling position. Now we were already here and doing the posterior pelvic tilt. So that posterior pelvic tilt that we did in that position before applies to this particular exercise. So I'm in tabletop, quadruped position. I'm gonna do a posterior pelvic tilt like I did before. I'm pulling my belly button into my spine and curling my tailbone under. It's not a fully flexed cat position like in yoga, okay? Thoracic spine is neutral. Lumbar engagement. Squeezing the abs, pulling the belly button up. From here, I'm actually going to squeeze my glutes now. It's the first time we've talked about engaging the glutes. Here we go. Try to squeeze those cheeks. Now, keeping all that, you're going to inhale and lift your knees. Hover the knees, just barely over the ground. Exhale back down. Inhale up. Now, if this begins to happen with your back, arching, then you know you're not stable. You know your back is arching in this incorrect hyperextended position. You want to make sure you're staying flexed. Now, as you go along, you may start well and then just weaken and weaken and weaken and back is arched. Stop before you get to that point. That's very important. Definitely don't go to that point of hyperextending the back. So again, you're doing something like a minute of those if you can. If you progress to this point, if you're not if you can't handle a minute keeping the good form, then just do less. Okay? Make sure you time yourself so you're focusing on the breath and the lifting. Okay? Now, we're gonna do one more anterior core engagement. This is a DNS drill, dynamic neuromuscular stabilization, a 3-month prone position. I've progressed these exercises from easiest to most challenging in my opinion. So again, pace yourself accordingly. Do this when you feel appropriate is for you. So you're gonna be laying on your stomach. Okay, and I'm gonna find what looks like, you may not be able to see it on yourself. Hopefully you're noticing it in the video now that I'm kind of in a 90-degree angle in the relationship between my tricep here, my upper arm, and my body. So this is a 90-degree angle, okay? But my elbows are slightly bowed out, okay? And what's important here is that my shoulder blades are not sinking together, but I'm protracting and pushing my elbows down, which is causing my shoulder blades to push away from one another, okay? This is engaging serratus, lats, okay, among other things, obliques. So my fingers are situated, and my fingers and hands are situated in a little triangle here. I'm protracting and pushing down. I'm gonna align my neck by pulling my chin back. My jaw is closed. Eyes are staring right at the tips of the index fingers. There's a lot of things going on here. So rewatch this video, rewind, go back, rewind, go back, that's fine. From here, I'm gonna squeeze my glutes, and I'm gonna pull my belly button up into my spine. You may not be able to see because of the shirt, but as opposed to allowing my belly to fall into the ground and my back arching, I'm pulling that belly button up like we practiced before in the posterior pelvic tilt. Now the glutes are still engaged, I'm squeezing my cheeks, pulling that belly button up. Just this position may be challenging enough for you, but the next progression and the full exercise of this 3-month prone position is to push onto your hands with the elbows coming off the ground. And then very slowly down. Now the arms are working plenty, a lot. They really are working quite hard. So you'll notice your triceps get quite a workout during this as well. And if you don't want to go as high as I did, you just go here, push off, very slowly down. Now, what's the most important part of this entire exercise is that you're not pushing onto your hands and just doing a relaxed upward kind of cobra position like in yoga. So I'm just really arching my back right now. There's no engagement in my core. There's no flexion in my spine, okay? It's really important. I got that belly button up, shoulders pushing down, elbows pushing down. Then I push onto the hands, going onto my knees, keeping all stability. Look at my back now. It's still in that nice position, not arched. Okay, so I'm here, belly button is up, glutes are forward. As slow as I can lower myself down again, and hips back down. You can see I'm trembling. I'm really fighting to keep that position. It's not a relaxing position at any point. You're always thinking, pull the belly button up. Okay. Now I didn't say anything about the breath. It's a bit too complicated for this one for you guys to focus on. Eventually we'll get there, but I really want you to focus on all those positions, one after the next in the manner that I gave them to you. So we got anterior core. At this point, especially if you've gone through all these at the same time, if you've gone through each of these exercises, your core is probably pretty tired at this point. So you don't have to do these all at the same time either. If you need to do the first few, rest a bit, or do them the next day, that's totally fine. But definitely get through all of these exercises within this week. The more you do with good form, the quicker the progress is going to be for that back in stabilizing the core. Now, as your core gets more stabilized, the whole reason why we're doing this is to align your spine, to create a natural traction with the engagement you've just created. When you create this natural traction and engagement with the core, it's decompressing the spine, which allows blood flow, space, movement, all that mobility allows things to begin to fire and function properly, rather than being stuck, junky, tight, and painful. So all those exercises, again, I'm going to rewind, you're doing for something like a minute if they're appropriate for you, okay? Something like a minute if they're appropriate for you, and try to do them as many times as you can throughout the week if you're maintaining that stability. So go do them. Right now, they're fresh in your head. Feel that engagement. You're going to feel about 6 inches taller as soon as you finish them. So go show off.